we have some wonderful guests tonight. They include Dr. Ori Viele, the acting Contra Costa County Health Officer and Medical Director of the County Health Department. Dr. Viele, thank you for being a part of the call again tonight. I know you were a part of our telephone town hall last week, and we appreciate you being accessible to all of us. And I know a lot of questions that will come about the order today, which I'll review in just a moment. We also have on the call L. Karen Monroe, who's the Alameda County Superintendent of Schools, Dr. Kelly Bowers, who is the Superintendent of the Livermore Valley Joint Unified School District, and Dr. Robert Martinez, the Superintendent of the Mount Diablo Unified School District. As you may have been told, this call is being recorded, and we're going to post it on my website as the other two telephone town halls have been posted. So if you want to go back and review information that's been shared, you can do that, and certainly you can share that link to others who are looking for this type of direct information. The website is sd07.senate.ca.gov, and I'll repeat that website at the end of the call. And finally, we've gotten dozens of questions for our guests tonight. You can continue to send questions to me that I can ask them about right now. That web address is senator.glazer@senate.ca.gov. So, Dr. Viele, let's start with the county order today. It was a health order, not just in Contra Costa County, but it applied to our neighboring counties of Alameda, San Mateo, Santa Clara, San Francisco, and Marin. And that mandatory health order directed people to shelter at home except when providing or receiving essential services or for essential travel. And let me try to summarize what those elements are. What would be considered essential activity or essential travel? And the order does identify a number of those, and let me review them first. Performing tasks that are essential to your family's health and safety, and that includes your pets. Obtaining necessary services or supplies, including groceries. Engaging in outdoor activities without coming into close contact with others, so these are considered essential. Performing work at an essential business that is defined, and I'm going to go through that, or to carry out activities permitted in this health order. Obtaining services at any healthcare facility, including veterinary care, but that does not include gymnasiums. Travel to obtain or deliver goods or services to households or other entities, that would be okay. Travel to care for elderly, minors, dependents, persons with disabilities, or other vulnerable persons, including pets, would also be okay. Finally, travel to educational institutions to receive materials for distance learning or meals and other related services, and I know we're going to talk about that in regard to the schools. Now, the order also defines what would be considered an essential business that can operate under this order, and those include healthcare operations, grocery stores, and that stores does include Target as an example that has grocery and non-grocery items. Pharmacies and healthcare supply stores are considered essential businesses and can continue to operate. Gas stations, auto supply and repair, banks, and financial institutions. It's okay to have hardware stores open, plumbers, electricians, exterminators, and other services to maintain safety and sanitation and essential operations of homes and businesses. It's okay for educational institutions for purposes of facilitating distance learning. That's all right. Laundromats and dry cleaners. I know I got a question about laundromats. Restaurants are okay if you're preparing food for delivery or carry out, not table service. Airlines, taxis, and other private transportation's okay. Businesses that supply other businesses providing products or services exempted in the order. Shipping and mailing are okay, including P.O. boxes. Child care facilities to enable employees exempted in the order to work, and that's principally in the area of health care. Home-based care and residential facilities for seniors, adults, and children. Essential government functions, and newspaper, TV, and other media. So that's a review of the essential businesses. Let me bring in our friend from Contra Costa County, the medical director and acting health officer, Dr. Viele. thank you for being on the call. I've reviewed some of the basics of the order today. Are there things that you want to add to that?
Yeah, I mean, I really quickly want to say why we're doing this, and this was an unprecedented cooperation between the 6 largest counties in the Bay Area. We all issued the same order at the same time. It goes into effect at midnight tonight, and it lasts for 3 weeks until April 7th. And as the ending time for that approaches, we will take a look to see if it needs to be extended or not, depending on the situation on the ground. We did it now because I talked about this at the last town hall that you hosted, Senator Glazer, but we really are trying to what we call flatten the curve, change this coronavirus incidence of new cases from lots of them happening at once to a slower simmer rather than a fast boil. And we think that will help us not overwhelm our healthcare infrastructure and allow people to get the kind of medical care they need should they become infected. It will be particularly helpful for those of us who are more vulnerable medically, who have chronic health conditions, and those of us who are older who are most vulnerable to COVID-19 virus. You went through the list pretty well. I just want to remind people you don't need to hang up and run to the store because food stores are open, grocery stores, farmers markets, convenience stores. Restaurants will stay open for takeout and delivery. Hardware store, plumbers, banks, community benefit organizations, laundromats, laundry services, and government offices, including transportation, utilities. All of those essential services are staying open. The things that are closing, really the biggest impact that you will see, other than staying in more and not congregating together, is you'll see that restaurants are closed for dining in, and then bars and nightclubs are going to close, and entertainment venues are going to close, gyms and fitness studios are going to close. So that's a pretty big impact, and we know that's a big deal. I also the reason we are doing it is we think that acting now early in the epidemic can save lives. To give you an example, from the 14th to the 15th, so from 2 days ago to yesterday, the number of cases in the Bay Area went up by 16%. So we're feeling like we're approaching this sort of exponential rise in cases, and we really want to do whatever we can now, and we know that doing it early makes more difference. The last thing I'll say is that even the businesses that are closing, there is a provision for them to basically maintain what's called minimum basic operations. So I got a call from a business owner of a nursery that sells plants, and he says, "Well, I got to have someone there to water my plants so they don't die," and that's just fine. And again, the principle behind this is to try to increase social distancing. So I told him, go ahead and open up, but make sure your workers are at least 6 feet apart. He also sells plants for food, so that's part of the food infrastructure. So he's allowed to sell for that purpose. I said, people in line, they should be 6 feet apart too when they're waiting to pay for their goods and services. So that's really the point here. The point is to increase social distance so we don't infect each other and we slow down this infection.
Dr. Vieli, a common question that I've been getting is that people will look at how many cases there are. In the case of Contra Costa, how many cases of coronavirus have there been identified so far?
Yeah, our count today is up by 5 cases. So yesterday we were at 29. Today we're at 34. We have the number of cases as well as the new shelter-in-place order and a frequently asked questions document posted at cchealth.org/coronavirus, or if you just go to cchealth.org, you'll see it. It's the first click. You go to the coronavirus page, and there's a lot of resources there for all sorts of constituencies, including the new order and the frequently asked questions as well. And we update the case count in the county daily on that website.
And we also have a link to your website on mine as well. But given the low numbers, I know that there's been an absence of testing, so there's extrapolation that's being done about how many people really have been affected versus those who we know through our healthcare system are affected, as you so indicated. And people talk about the trajectory, and some have suggested that the trajectory in the United States is similar to Italy's. Can you talk about these projections, this issue of trajectory, and why such few cases have created such distress?
Yeah, that was a really great way of saying it. We basically think that for every case that we know about right now, there's about 10 cases that we don't know about. Some people are very mildly symptomatic and don't come in. Some people, we haven't been testing enough, and the test hasn't been widely available, so we really haven't had the capacity to test everyone we would like to test. So there's more people out there, and even if they're mildly symptomatic, and some studies even showed asymptomatic, they can spread the disease. And once it hits a basic breaking point, it's very hard to slow the spread. You know, I mean, if you look at what we're doing, they're pretty drastic measures. If you look at what China did to handle things, they let things go further before they acted, and they really stopped all movement completely. I mean, they were stationing police officers in the street and stopping people from leaving their houses, and they were doing temperature checks on the street. So we're not at that point yet, but we are. I mean, we know we're asking a lot of people, and we know that this has a huge impact on people's lives. You know, work, people aren't going to work, people aren't congregating and having dinner parties, people aren't socializing in their way that they're used to, and we are social creatures. So we know it's a big ask, and the reason we're doing it is because of that exponential rise, we want to sort of slow this down and take a big measure up front to really affect the curve of the epidemic.
Thank you for explaining that. I want to go to some of the questions that I've gotten, but just one closing note in our conversation is that many experts, as they look at the trajectory of this virus and how it has played out in other places in the world, and they can see that exponential rise happening very, very quickly. And there is many that feel that if we don't curtail it now, our healthcare facilities will be overrun. And correct me if I'm wrong, doctor, but some of the general observations about this virus is that about 80% or so of the people who get it have very mild symptoms and may not even know that they have it. But those who are elderly, those who have compromised immune systems, makes up in the neighborhood of 15 to 20% that are going to require some potential serious either hospitalization or health care and even intensive care. And that is, as people project out the trajectory, including the counties of the Bay Area, they can see where we're going to get to a point where our health care facilities are not going to be enough. And a lot of the work that the governor is doing and other leaders of our state are doing is to prepare for this surge because they know we don't have enough beds. And so this work to flatten the curve, the work to flatten the curve is not that everybody's going to be stopped from getting the virus at some point, and many will, but that our healthcare facilities will be able to keep up and be able to give them the maximum amount of care that's necessary to get them better. Is that a fair
I think,
explanation?
Yeah, that's exactly right. I think I couldn't have said it better myself. We run a fairly lean healthcare operation in the U.S. We don't have a lot of excess hospital beds, excess ventilators, and so when something big like this hits, it can overwhelm the little bit of extra capacity we have pretty quickly. We are, and part of this is also buying us time. You know, if we can flatten this curve a little bit, it buys us time to buy more ventilators, which we're doing in our country. It buys us time to develop a vaccine. It buys us time to do clinical trials on potential treatments that may help shorten the course of this disease. So it's really important to buy ourselves that time and slow it down so it's not one big peak. You know, we want it to be a much flatter curve.
So we had executives from Kaiser Permanente and John Mira on our telephone town hall yesterday, last afternoon, Sunday afternoon, and they talked about the steps that those major hospital systems are doing to try to prepare for this surge of healthcare needs. And we appreciated them coming on, and we'll bring them back into a future town hall as things move forward so we can get a status report on how they're doing. Doctor, if I could, I've gotten a number of questions. I can zip through them here, and if you can help provide some insight into the concerns that I'm getting from our callers. Lloyd asks, do you need to carry any specific documentation with you in case you're stopped by law enforcement? What would you say to Lloyd?
No, you don't. No, you don't. And I don't think our sheriffs or police departments are going to be out there stopping people and going and trying to arrest people. This is a legally enforceable order. We want people to adhere to it and take it seriously. But we're not looking to crowd our jails with arrestees based on this. So if someone asks you, you can just tell them what you are doing, and hopefully you're out there doing something essential.
Very good. A caller asked about farmers markets. She heard that they're all closing, but she felt that she heard that they're exempt. Are both of those things happening? One, are they exempt? And two, they may be closing because of other reasons in terms of social isolation.
Exactly, yeah. Farmers markets are considered part of our basic food infrastructure, and so they are exempt in this order. Some of them may choose to close exactly because of social isolation. I think the one thing you may see for those that stay open is the food stalls may not allow for seating, just the way that restaurants don't. We don't have dining restaurants anymore. They may only sell as a takeout order. But,
Very good. Very good.
As far as this order, the farmers markets are open.
Okay. Ben writes, laundromats, are they considered essential services? I think I confirmed that they are considered essential and allowed to remain open.
Yes.
Okay. Very good. Erin writes in and wants to know about her physical therapy activities. Are those sessions okay for people to go to if they need physical therapy? Does that meet the definition of health care?
Yes, it does. Physical therapists are considered health care, as are dentists and optometrists and podiatrists and pharmacists. So all of that counts, not to mention doctors, nurses, hospitals, clinics, etc.
Very good. Paola.
But the gyms are closing. The fitness gyms are closing.
Okay. Paola writes in asking about her bilingual learning center that she has in Pleasanton. Are learning centers that have morning, evening programs, are they going to be required to close, or how would they be treated under the order?
I believe it sort of depends how it's set up. I believe that if it's set up that there is adequate social distancing, I think it can stay open, or if they alter their setup to allow for that. Otherwise, they will need to close for this period of time.
Okay, very good. Thank you for that answer. A number of people have written about child care, and we're going to talk about child care with our superintendents in just a moment. But obviously with school closings, child care facilities, child care for parents that still are working in essential businesses become a really acute concern. Can you address the rules and regulations now relating to child care?
Yes, I'm trying to pull them up, but child care essentially, there's I think it's section 10, sorry, it's a complex order, section 10, letter F, and then Roman numeral 21, XXI. They're allowed to stay open, basically. It has to be in groups of 12 or fewer. And if it's a larger child care, that they may divide them into two groups of 12, and then they're not supposed to intermix the kids between the groups. But they're allowed to stay open. We recognize that child care is a really important resource for our workforce. And you know, when the schools closed, we immediately got a ton of sick calls for our healthcare facilities. And part of my interest is making sure that we have a stable healthcare workforce to handle the the influx that we're expecting will be coming in the next few weeks.
And how, I've heard from a number of parents and people that are struggling with this, and they've talked about, basically a co-opt element where a parent would stay off from work and take care of multiple children. Is that okay, and what would you advise in regard to those circumstances where parents get together to try to take care of the kids but still allow some to go to work?
That's a tough one. I can't say I would recommend it because it is bringing people together, and what we're trying to do is not. But what I would say is if you have to do it and you're doing it, try to keep the group really stable. Don't have different kids in the group every day. Try to have, the same group of people sharing the same germs in a stable way so that there's less intermixing, if that makes sense. And then the other thing I would recommend, as long as the weather allows, is try to do outdoor activities where there's just a little more social distancing naturally.
Well, I appreciate that feedback, and I'm sure there's a lot of parents on the line trying to figure that out. Just two final questions. Mike writes in and is trying to understand whether his business is defined as essential, and he talks about it's a supply chain for fire departments and police departments in terms of the components they provide. Another one is a supply chain for telecommunications. So what do you say to a business person who's obviously trying to follow the rules? They believe that their work that they're doing is very important. Where do they go? You may not be able to answer that specific question on this call today, but where does someone go to understand and make sure that they're trying to follow the rules as best they can on this question of are they an essential business?
That is such a great question. I'm glad that the caller asked that. We have a call center exactly for these sorts of questions. I can read out the number now, and it's also at the very end of the order. So if you pull up the order on cchealth.org, the very last number 15 has the number for the call center, but it's 1-844. It's a toll-free call, 844-729-8410, and that call center is staffed from 8 to 8 a.m. to 8 p.m., and it will be staffed all week, I think, for people to ask those sorts of questions. And we may not figure it out right away, but our staff has a channel to get to the health officers to help make those determinations on the tough calls, and we'll get back to you soon enough if we can't tell you an answer right away.
Can you give us that phone number again?
Sure. It's 844-729-8410.
Okay, so for further questions. Well, Dr. Vielle, you've been a great source of information. We so appreciate you being on. I know you can't hear applause from the crowd, but I know you've provided very valuable information in this very difficult time with really unprecedented orders being directed from the county, all the neighboring counties. It's very likely that the orders that have been established here in the Bay Area will be ones that will be put in place throughout the state in the coming days, unfortunately. But I want to thank you. I hope that we can invite you back to be on another call because I know there'll be more questions. Appreciate it.
I'm happy to come back anytime, and I just want to leave you with a note that I know this is a difficult time, and I'm just so grateful to the outpouring of concern in the community that people have had for each other. They're really trying to do the right thing, trying to take care of each other and looking out for each other. And even though this is going to be a tough period ahead, I'm confident that we'll be able to get through it. And I really appreciate you doing these town halls to get the word out. So thank you again.
Thank you very much. So next, I want to go to our education leaders that are on the call. Thank you for your patience. If I could, maybe starting with Superintendent Monroe. You are the superintendent for Alameda County Schools. Is that right?
Yes, that's right.
Right, and I understand that the local schools are awaiting guidance from the state on some of the details of how the school closures are going to work. What sort of things are you working through, and how? What kind of guidance going forward can you provide people with information about?
So we're working through things on multiple fronts. As everyone on this call certainly knows, this is a highly changeable situation. So, for example, yesterday we had many things in place, such as where food distribution would occur across all of our districts, including our Tri-Valley schools, which you, Senator Glazer, represent. And then today, we received the order, and a myriad of questions then came up about how that was going to work and whether there would be sufficient staff to ensure that those centers could fulfill their mission of passing out meals to families who needed them and who qualified for them, and quite frankly, just anyone in the community who was in need of it. So we had a call today with both representatives from the administration, from Governor Newsom's office, as well as State Superintendent Tony Thurmond, to really give input on guidance that will be coming out tomorrow for exactly how we need to handle these situations. And what we're finding is that, though we're an essential service, and though those who are in our employ are emergency workers, that all of those folks have families and concerns of their own. So we are really trying to navigate the personal needs, and as well as those who are over 65 who have been given a shelter-in-place order the day before from the governor. So those employees need to be at home as well. So we are really looking at how to staff those things. So, for example, at the Alameda County Office of Education, as well as the Contra Costa County Office of Education, we pay every education employee in the county. We want to make sure that those employees receive their paychecks in a timely manner, which requires that we have staff continue to come in, though the office is closed. Same thing for all the networks. We also do network backup for a handful of municipalities as well. So needing to have staff and really working out how we're going to do that with those who have children and or elderly residents. So those are in real time some of the issues that we're dealing with, and not to mention the challenges of distance learning and, as was discussed before, child care, particularly for emergency workers.
So this is a difficult question, but let me ask it, and I understand it if you don't have an answer today. But
all right.
Do you expect the school year to be extended into the summer? You don't know how long the closure is going to last, right? And we all don't know.
That's true.
These shelter-in-place orders, how long they're going to last. So I know that's a difficult question, but
yeah.
But do you have any sense of any early planning about whether the school year, depending on how long this goes, will extend?
Right. So as the days and weeks progress, we are understanding that we need to be prepared for a number of eventualities. So most of the districts in both Alameda and Contra Costa County that are closing have initial plans to be closed from anywhere from 2 to 4 weeks, and then looking at the potential of reopening. However, as fast-moving as this is, we all understand that may or may not be possible for us. There are districts who are looking at the ability to open schools or daycare centers for, as I said, emergency workers. However, we absolutely don't know. What we're doing is preparing to reopen and staying flexible and staying in constant contact with one another. We have superintendent calls on a frequent basis and staying in touch with our communities. I think, Senator Glazer, one of the most unfortunate outcomes of this will be our graduating seniors and those who have it's not just the social opportunities such as prom and dances and those sorts of things that happen at this time of year, but we really have to figure out for those who are graduating and need the credits or have graduation ceremonies planned, that sort of thing. It's going to look very different than it's ever looked if this goes on through the end of the year.
Yeah, yes, indeed. I mean, I think we all shed a tear for the such a dramatic impact on our young people's lives when these are real life events. Proms and graduations and all these things are just such a huge thing, and I know that if we could find another way around it, I know we all would want to do that. But it speaks to the severity of this, that these actions are in place, and you have to find a way to make it work. I know we're going to talk to some of the other superintendents in a moment about distance learning and food service delivery and things that are very important that I know we've gotten a lot of questions about. But certainly if you're a parent and you're thinking about your summer plans, summer vacations, camps, all the things that in a normal child's life you'd be thinking about, the word is basically you have to just take a pause, right? And we have to see how this thing evolves, and so that you can decide. We know how important that learning is, and I know that you're trying to figure out how you can engage your school community remotely in learning so that they can not waste this time, but somehow have it enhance their life, as we know education does in general.
Right, and what we also know is that I heard today our Surgeon General for the state is going to be looking at issues of mental health during this time. It's very difficult for all of us to be isolated, but particularly children who are used to being in a social environment, and really looking at what the impact might be to kids who may or may not have a good place to spend this time away from school. So we're really looking at what some interventions, in addition to academics, might look like for their social-emotional well-being.
You may not be in a position to answer this question, but it is something I've thought about a lot and wondered whether we might want even to do a separate town hall on. But it's about how we talk to our children about what we're experiencing now. For those in the know, we know how really deeply troubling the future looks to be. We want to be optimists about it, but we know we're doing these preparations because we see danger on the horizon. Do you have any thoughts about how we talk to our kids about this? They obviously know school's been canceled. We are experiencing some activity by kids that isn't healthy, in terms of going to the mall or being out and just considering it a vacation day and not really realizing the seriousness of it. Any guidance that you would have for parents listening about how to talk to their kids?
I think it varies, of course, according to the age of the young person you're having the conversation with. What I can tell you is that today, in fact, I talked to a group of mental health professionals who are putting together an FAQ on how to actually speak to children at different ages about this. So there's definitely, with younger children, you're going to want to be careful of how extensive the details are, and you're going to want to emphasize the fact that that they're safe with you, and to just make them feel as though they're safe and cared for. With children who are slightly older, they're perhaps seeing the news and hearing these things and making sense of them, and you want to reiterate the same thing about the safety and care that you're providing for them, while helping them to navigate what is true and what's not true. And I think that in this age of social media and just ongoing 24/7 media period, it can be a very scary proposition for a child or even a young adult to consider this. So they are definitely looking to us to remain calm and to actually help them decipher what we know and what we don't know. And I think it's okay to say that we don't know, and yet we are here and providing the very best care we can at all times. So, but as that information is available, I will make sure it gets to your office, Senator Glazer, and we have a myriad of resources at acoe.org, from food service to, of course, the portion of the orders that have to do with schools, just to name a couple.
Very good. And that's Superintendent Monroe from the Alameda County Schools. Thank you for your thoughtful comments on that. And if you'll stay tuned, there may be some questions that will be directed at you. But I want to invite two additional superintendents who are on the line. Dr. Kelly Bowers, the superintendent of Livermore Valley Joint Unified School District, is on the line. Dr. Bowers, are you there?
I am, yes.
Okay. And Dr. Robert Martinez, who is the superintendent of Mount Diablo Unified School District, is on the line. Dr. Martinez, are you there?
Yes, indeed. I am here.
Great. Well, if we could begin maybe with Superintendent Martinez, and you may have thoughts, both of you may have thoughts on my last question to Superintendent Monroe about how talking to kids. But let me go in a little bit different direction first. Superintendent Martinez, you have a lot of low-income students in your district. Do you have plans in place to get meals to those children who normally get them through their school?
Absolutely. What we've been working on is really initiating our summer feeding program, which is something that we routinely do through periods where we don't have continuous school. So our food and nutrition department has been actively preparing for services to 8 of our schools right now. That information will be on our website. I won't name them all right now unless you'd like me to. But what we're planning to do is that from the time of 11 o'clock to 12:30, starting on Wednesday, May 18th, we will have opportunity for drive-up curbside service where there'll be, in essence, packaged meals with a lunch and a breakfast for the next day. So we have been really actively ensuring that we have resources, that the food is appropriately prepared, and that will be ready for the number of individuals that we hope to come and collect food for really any child under the age of 18. And we probably won't be checking IDs, so we will really get as much food as we need to into a car to help out families and to students who come up to the school. While we won't be able to have any place for individuals to stay on campus to eat the food, again, they'll be ready to go for them.
Very good. I'm really glad to hear that. And can you give us the scope of how many kids in your district take advantage of the free lunches or lower-cost lunches and breakfasts?
Sure. When we think about our unduplicated count, we're just shy of 50% of individuals who qualify for our free and reduced lunch program. So it's a considerable number of students that, while we'd like to be able to have opportunities for such at every school, again, the sheer magnitude of trying to run the food preparation for something like this, we've relegated it to the 8 sites. And so we're really kind of regionally preparing opportunities for students. I will say that in the Riverview Middle School, one of our schools in the Bay Point area, will definitely be one, and area schools within the Monument Corridor, Cambridge, Meadow Homes, are also available for food. And
for those who are not familiar with your district, 50%, what is the number? Approximately.
So we have close to 30,000 students. Over 15,000 would qualify for some level of support with meal programs. We see food as being a critical area, and that was one of the main components of Governor Newsom's executive order last week, indicating that meals prepared through the summer food program or seamless summer options. And I will say it's a little bit different, however, because with the new parameters of shelter in place, with some of the constraints on even our workers, ensuring that we have the appropriate number of staff to prepare these meals, who, again, the age limitation is something that affects us as well. So working within those guidelines to make sure that we can put these programs into place, our goal is to have these 8 programs working as long as we need to help our families and our students.
Great. That's Dr. Martinez, the superintendent of the Mount Diablo Unified School District. That's not easy to do that. 15,000 meals, even when you're under such restrictions. We appreciate it so much. Obviously, it's so important that these folks who depend upon the schools for their nourishment during the day can still have that benefit. Dr. Bowers, you're the superintendent of Livermore Valley Joint Unified School District. Thank you for being on. Can you talk to us a little bit about your district's plans to educate students during this shutdown? Is there anything happening there, and what are you trying to do, or what do you hope to do?
Certainly. So what we've been working on, actually, in anticipation of some type of dismissal of students, and just in case, is a variety of distance learning and remote learning opportunities. We have our website is already up with resources that students can access on their own, but we also know we don't quite have the size of the district that we were just speaking about, but we do have about 25% of our 14,000 students who are on free and reduced lunch. And one of the things that we wanted to make sure is all of our students had access to work remotely. So we are in the process. We've been checking out, identifying students who need Chromebooks, and they're in a checkout process. And if they need internet, we've arranged for free Wi-Fi that is also network protected as part of our network, and or hotspots that students could take and check out. So that's one of the things we're working on, because our learning will not be, we've suspended in class, and this was even prior to today's order for shelter in place. We had suspended in-class instruction because of the gatherings, and so along with everyone in both counties, Alameda and Contra Costa. And Livermore has a unique distinction. We actually are primarily in Alameda County, but a portion of us is in Contra Costa as well. That's where the joint comes from. Just a little fun fact. But we are working. Did you realize it? Oh, but we are working on this, facilitating the distance learning and providing, because that is definitely an essential function for children to continue to learn. And to your other question earlier, we have also mental health resources. We've beefed up our online resources as well. We know that this is a time that for children and even their parents, it can be, unnerving. It could be scary. There's a lot of unknowns, and we hope that students will take this time with the guidance of their teachers through the distance learning, as well as with their parents modeling that, and all of the adults. They're learning from us. How do we handle this? And it will be a life learned lesson how we all get through this together. And one of the things we're doing a lot of is with our Choose Love program, and that's our social emotional learning. So there'll certainly be other types of learning, but the social emotional learning really comes into play. And that's when our students are going to learn and see in real life gratitude and forgiveness and compassion and action, as well as courage, because every single person is facing this crisis in different ways. And so we really think those life lessons are going to really, in the end, be something positive that comes out of this horrendous situation.
Thank you, Dr. Bowers, and thank you in particular for the enhanced learning as you just described. It's very important and appreciated. I know there are many people on this call that are not in the Livermore Joint Unified School District, and I've gotten that same kind of question about distance learning or digital learning from Amy, from Lisa in Alamo. And I guess my counsel there, we couldn't fit all the superintendents on this call, though they all offered to be on it, to contact the office directly and ask about their plans in your area. And as we do future calls, we may invite more superintendents to be on it to explain in detail what their plans are. Dr. Bauer, a question has come in from a different school district, but I'm sure it relates to yours as well, and that's the special needs population that's out there that had to require additional help in their learning environment. Are there any particular things that you're doing for special needs?
So our special needs students, actually, there are some specific things that will be happening. We still, our school district, and we still believe that we need to continue to hold any legal meetings, such as IEPs and some of those types of assessments and things. But that was as of yesterday's order. Now, with today's order, it will be interesting to see. So that's definitely a question that we have, because we want to make sure that the students still continue to learn. They'll have learning opportunities, but we also understand that they may not be the exact same services that they are accustomed to receiving. And so there are extended learning opportunities. All students will be learning, but there will be there'll be different varieties of how that will be given. But my understanding, and it may be different going forward, is that legal meetings we should hold, but there'll be people participating in them through distance and remotely.
And Bill asked a question, and it's a different school district, but I'm sure it applies to you as well, and that's the issue of making up for lost classroom time. Any thoughts or plans about how to do that, or that's just something that we're just going to have to wait and see how long this lasts?
So really, if learning continues, then we expect people to receive credit for what they contribute and learn. And I don't have the exact answers because we haven't been through this before. In the short term, if it's 5 to 10 days, then students can actually have an independent study plan. And in this case, we believe it's longer. So actually, I've touched base with a retired colleague of mine who was the Napa superintendent, and he said it may be that it becomes something more along the lines of what happened with the fires and the Butte fires and the Napa fires and Sonoma. And essentially, there are waivers that can be applied for, so that the as long as learning was continued in some format, there may be waivers that we could apply for that would then allow the school year not to be extended indefinitely.
Okay. And Dr. Martinez,
we always will make decisions. I'm sorry. We will always make decisions so that the child is not academically penalized or punished for something that's totally beyond their control. That's always going to be in the best interest of children.
Very good. And let me invite Dr. Martinez or Superintendent Monroe. Anything to add on that issue of making up lost class time?
One of the things that we've been one of the things that we've been considering in the Mount Diablo Unified School District is it is the unfortunate reality that not every one of our children has a device or even can connect to the internet. So we're also being very cautious in the sense of putting expectations on our families and our children's, because there is an issue of equity here. So one of the components that we're also focusing on is asking all of our educators to connect, engage, support their children, as maybe through even a phone call, maybe through reaching out to the families, if we have access to email, doing that, because while we want educational opportunities to continue and we want to support our parents through resources, we also want to be cautious that we don't set unrealistic expectations on every child to be completing 6 hours of work every day. We know that there are going to be teenagers who are going to be asked, you need to watch the children while I go to work. So we're also trying to make sure and coordinate within real life what's happening for these children from our TKs through our high school seniors, quite frankly. So we'll be working, again, to address what we need to do as a district based under waivers and documents, but our teaching staff, we're also saying connect. Make sure our children feel your support, your love, your care, your guidance, so that they can continue to move forward in a supportive structure through these educational opportunities that are not going to be able to be acted upon in the same way by every child. So we're trying to make sure we understand that reality.
So that was Superintendent Martinez from the Mount Diablo Unified School District. Thank you for your sensitivity. Superintendent Monroe, did you have something to add?
I actually think Superintendent Martinez and Superintendent Bowers did a beautiful job of illustrating how complex this is and how district leaders are really having to grapple with what the needs of their community and their students are. What I can say, just from an administrative point of view, is that that as county superintendent, I'm responsible for receiving those requests for waivers for days of instruction missed, and working with the State Department of Education to ensure that those get submitted and are honored. Everyone across the state is saying we want to make sure that we're doing right by our students in California, and we are not seeking to penalize any student at all. So we're working really hard at the county and state level to ensure that that process is as smooth as possible to make sure that districts aren't harmed so they can do their best by their students.
And Dr. Martinez raised the issue of equity. There are many kids that don't have access to the internet. The Livermore superintendent talked about providing free access and trying to make that easier. Are there things that you're doing in Alameda County generally to help districts provide this distance learning?
We're looking at that right now because not all districts have the same capacity to provide those opportunities. And you're right, Dr. Martinez is right, as is Dr. Bowers, that equity is a huge problem. As you know, there are county superintendents throughout the state. There are 58 of us. There are rural areas where students don't have any access at all, and even hotspots are not an option for them. So we actually are having to look creatively not only at our distance learning options, but in some cases having to go to paper packets for students who need to ensure they remain engaged in the learning that's happening in their classroom. So we're having discussions at the Alameda County Office of Education right now to see if there are any economies of scale we can achieve, particularly for our smaller districts who may not have the resources to invest in a robust distance learning program.
Grace asked the question about preschools. In Alameda County, do you have preschools that are still open?
So our districts do, and then there are many independent ones. Something I can tell you is when we started our group calls, they were with our district superintendents, and then we quickly realized that we needed to include our early learning centers as well as our independent or private schools and public charter schools in those conversations, because they're all a part of the education landscape and all are needing answers and support. So our early learning partners are, now let me just say I haven't talked to them since the order came down today. We have a call tomorrow. But yesterday when we spoke, on Friday when we spoke, their main objective was to remain open as much as they were able to, understanding how the service they provide, if they're not providing that service, impacts the workforce. So I think we'll have to see with the shelter-in-place order now and needing to maintain the kind of social distancing that's required, how that changes things for them. But I would say of all our entities, they were the most adamant about needing to remain open no matter what.
And Dr. Martinez or Dr. Bauer, anything about preschools in your area that you could share?
So I would say that the preschools that we have associated with our special education programs right now have fallen under the same guidance of we have closed them if they've been part of our school district. Other daycare programs that are working on our facilities, we have some that are, in essence, our after-school programs. Those are also closed right now. So we have this conundrum that, again, part of the executive order has said to the extent possible we should support child supervision, and yet with all the other parameters that we have, we've also been restricted in having employees come and sustain those programs. So I think our Alameda County Superintendent kind of indicated we'll have to take a look at what we can do. Are there certain levels of now activation that we create some new programs for students? And that would be, again, a significant change into something that we have done in the past as far as new programs. The preschool programs associated with our actual school district are now not engaged right now, so our families are having to look for other areas of support within their communities, which is a struggle.
And Dr. Bowers, does that be the same for Livermore on that front?
It is almost identical, yes.
Okay. All right. I've gotten a number of questions about the AP exams, ACT, SAT, whether those are going on from Damon Preet and Elizabeth, both asking about that. Can you share any insight about the college entrance exams and if they're happening or not? And maybe we start with Superintendent Monroe from Alameda County.
On this one, I would defer mostly to my district colleagues. However, this was one of the subjects on the phone call with the California Department of Education today, and actually not just those critical exams for those looking to get into college, but also state testing, which is coming up, and what we would do about state testing. So there's going to be guidance, at least on state testing, perhaps beyond, tomorrow from CDE that we'll be looking to guide those decisions. And I think this also brings in our higher learning partners to say what if a student is not able to take the SAT or the ACT, what provisions do they have if that is a reality? So I'll defer to Drs. Bauer and Martinez on the rest.
I am getting a note from my staff that says the ACT and the SAT have been postponed. I am looking for
That's
a source
true.
from that. The college
They
board
are.
that's so indicated.
So the SAT, the college board did cancel the SATs, and we know that because we are host sites in our local college, Las Positas College, and so we had planned initially. We just had this last Saturday to have, there's always a lot of distance because they're highly proctored tests, right? But to make sure we were going to follow all of the other guidelines about gathering but then they were canceled. And we do know of legislation, and perhaps you'll have a chance to weigh in on this legislation at some point, is that there will be some AP, advanced placement test fee reimbursement, because families pay for these ahead of time, and so for right now they're being postponed or canceled temporarily. It's hard to gauge, but then there would be a reimbursement for families, and there's some legislation being proposed for that.
Okay, good. Thanks for that information. Sarah writes in and asks, is there a central place parents can go to find out which schools will continue to offer meals? Dr. Martinez, is there a place for Mount Diablo that they can check out?
Yes, I'm anticipating, or it'll be posted on the website, really on the front page. We were looking for some clarification this afternoon, and that should be up later this evening.
Okay, good. And Dr. Bowers, anything for Livermore?
Yes, so we have 3 schools where we'll be distributing food because we have the summer waiver, and we were actually going to assess that and to see later if we needed to expand that or consolidate. And I actually asked the same question, and I believe our Alameda County Office of Education has all of that in a central place, because I inquired about that as well.
Okay.
And there may be some adjustments to it, but I believe that's on the site.
And Superintendent Monroe from Alameda?
Yes, we have that on our site, as well as all those sites are actually mapped out on a Google map, where families can go across districts to ensure that they're getting meals. And again, I think Dr. Martinez referred to this, while districts are set up to make sure they're serving their own students, I think in these unprecedented times, no one's turning a child away. So having that map certainly across the county, I think is helpful on many fronts. We're also working with the Alameda County Food Bank. Should augmentation going forward be needed, particularly as we are having some challenges with really ensuring that we have staffing going forward to make sure that these meals are available. So it's on our site. We update it daily. There's, as has been indicated, the next 24 hours will surely be a number of changes as the order has gone out.
Well, let me go, as we conclude our town hall tonight, let me ask a question that Rick has written in on, and it causes me distress, and I know Rick, and for many, and that's the void, he calls it the void of seriousness by some of our youth about the virus, that he reflects that it's viewed as free play, like at recess, and that he has seen behaviors already today that aren't reflective of the seriousness of the event. Thoughts from our guests here about that circumstance?
Well, I just believe that there is there's a tension that happens when people want to shelter children from harsh reality, but then again, if you over-shelter them, it may not seem real. My sense is that we did put out videos on our website, and it's open to anyone, about how to talk to your children about this crisis. And so I think a guided conversation is in order, and it's also for different levels, how to talk to your younger children, how to talk to an older one to help them understand. And unfortunately, what I know from having friends and colleagues in Washington, it's in a way it's a good thing that they're not taking it too seriously, because that means it hasn't hit home, because it usually, unfortunately, takes an actual death or case. And so in Livermore, for instance, we don't have any confirmed cases. That's not to say there aren't some. And so unfortunately, I believe that with even one noticeable effect of one child or adult in our community, then suddenly it becomes real. So, but I also think that now, as the shelter-in-place gets going, I really do see they lost their athletics. The children are grieving also, even without life loss. Their life is no longer normal. So their little league and their basketball championships and all of these things are just being taken and taken and taken. So I would caution people to not judge them too harshly, but to give them guidance and leadership and show them what is okay, because they don't know, and they probably have a lot of pent-up anxiety, and social media can fuel that. So I don't know. I tend to give our kids the benefit of the doubt, and I know our young leaders are already writing in their newspapers and their journals. They're preparing articles to cover this important situation.
Yeah, this is Dr. Martinez. One of the things that I would add, and I appreciate those sentiments, is that our young people are very much in tune, I think, with what's actually happening locally and more so even globally. We had a board meeting on Friday, a special board meeting, and one of our students came from our high schools and reiterated a point that I've also said at a board meeting, that every decision that our board is looking to make impacts him and students all throughout our school district, and that they are really living the results of our decisions. And he was one that was saying, we understand. We know you're going to need to close and do these different things, and we understand, but include us. Include us. And I think, the point being that we have to stay calm, we have to stay focused, we have to stay resolved that we're going to get back to having education and students coming, but we also do need to include our students as appropriate when we can to help them build their actions so that they know we're doing this for a reason. I think many of our students understand the social distancing aspect of why, in fact, we are not having everybody continue to gather, and the process that could erupt if we didn't, and the overwhelming nature of what could happen to our medical infrastructure. We need to spread this out. We need to keep people apart. And they're aware of that. And so while we may have some examples of students trying to gather to play to seek normalcy, I think to some degree we're also going to empower many students to make life changes earlier than they ever have before for the betterment of their own society as they grow and become the leaders of tomorrow.
Well said, Dr. Martinez. I reflect back on my youth, and we all have different ages, but I remember during my formative years where we were at the war in Vietnam, and there was great fear about nuclear weapons. And I go back and look at some of the things that I wrote about at the time, and realized that there was a lot of trauma, in our early years too, and of course those who went through World War II, the Depression, our parents and grandparents, they certainly had the same traumatic time. We do shed a tear because there's the innocence of youth, and we know how wonderful those years are, full of lots of stresses too. But we want to protect our kids, and we want to shield them from harm and bad news, and yet it's hard to avoid the news that we're dealing with today. But I want to thank you all, Dr. Bowers, Dr. Martinez, Superintendent Monroe, for your inspirational leadership that you're providing in your districts and your communities. You bring a lot of wisdom. We heard it tonight that has benefited our educational leadership in your areas and in our state. And I'm very grateful for you to participate in this call tonight.
Thank you for having us.
I want to thank
you. We appreciate being included.
Thank you, and we may invite you back. I want to thank Dr. Vieli, the acting county health officer, the medical director of Contra Costa County, for being on earlier and sharing the news and information on this health order, the shelter-in-place that now is coming into effect at midnight tonight. So that completes our questions for the night. I want to thank everybody who participated and those who have joined the call to learn and listen. It's an unprecedented crisis, and as residents of this region and this country, we are being asked to take actions that many of us never imagined were possible, and it's going to be difficult for all of us. And for some, the financial burden may well be more than they can bear, and we're hearing a lot of stories about that even days after this has really begun. And that makes it more important than ever that we all come together and help each other as much as we can. And in the weeks ahead, some of us might need to sacrifice a bit so others, especially our seniors and people with compromised immune systems, can be safe. As we move forward together, I'm hopeful that accurate information about the nature of the threat, how we're dealing with it, to me, is critical. It's part of why we're doing these telephone town halls. I hope that it has contributed to your understanding of important activities in our community for our kids and for our own health. Our plan is to have another telephone town hall on a different subject tomorrow night that I've heard a lot about from my constituents. and that's about the availability of food and medicine from our area drugstores and pharmacies. There's been evidence of hoarding. There's been empty shelves that I'm sure you have seen on the news, and we are trying to bring in the leadership of our retail sector to be on this call to share accurate information, factual information about what they're doing. Is there a scarcity? I don't believe there is, given the information that I have seen, but obviously we have seen the store shelves empty, and it raises anxiety and concern. There's also been a concern raised about the elderly. The governor's order from yesterday said that those 65 and over needed to be sheltered in place. Our county rules now are even more strict for that. But what are we doing to help the elderly get food? Should there be special hours at our marketplaces and in our pharmacies so we can protect them from exposure from others when they need to do life-saving work to get food or to get medicine? So those are some of the questions I'm hoping that we will have experts in the retail and pharmaceutical space participate in our call tomorrow, which is currently scheduled for 3 p.m., and we'll put out a notice probably tomorrow morning about that. If you would like to listen to a recording of this conversation, there will be a link on my website tomorrow morning so you can share it with friends, or you can go back and listen to something that you heard to double-check it. That's the website is sd07.senate.ca.gov, and at that site are links to the latest information for the Center for Disease Control, the county public health departments, the offices of education, some of whom were on the call today. We'll provide links to their sites so you can get as much information as possible on these important questions that I know you probably still have. And finally, you're welcome to send additional questions to me. You can email them to me, and I will do my best to answer them or refer you to someone who can. And that email address, which was on the invitation, is senator.glazer@senate.ca.gov. I thank you all for listening tonight. Be safe, and I wish you a good night. And my fingers are crossed that we can get over the difficulties that we're facing sooner than later. We can protect our healthcare systems and the health of all of us. And I'm optimistic that we'll be able to do that if we all work together. So with that, thank you to my guests. Thank you for the listeners. And I wish you a very good night.